First of all, we will introduce you to the Electrosurgical module, which is divided into 5 functions: pure cut, blend 1, blend 2, blend 3, and intelligent mode. Pressing the yellow button of the Electrosurgical pen will activate the electric cut and can also be activated by stepping on the yellow switch of the foot pedal. Pure cut function is mainly used for cutting tissue and has a weak coagulation effect during the cutting process. The blend 1 function is mainly used for cutting procedures with low coagulation requirements. 70% of the energy output is used for cutting and 30% for coagulation. The blend 2 function is mainly used for cutting procedures with medium coagulation requirements. 50% of the energy output is used for cutting and 50% for coagulation. The blend 3 function is mainly used for cutting procedures with high coagulation requirements. 30% of the energy output is used for cutting and 70% for coagulation. Intelligent electrosurgical function is the advanced version of the pure cut function. It does not need the doctor to manually set the output power. Intelligent electrosurgical function will identify the state of the tissue and power adjustment at a frequency of 100 times per second. Real-time dynamic adjustment of the output power to ensure that the minimum thermal damage to achieve the optimal cutting effect. No need for the doctor to manually set the power. Convenient, quick, simple and efficient. Avoiding the serious thermal damage caused by manually setting the pure cut output power to high and the phenomenon of poor cutting caused by setting the power to low. For pure cut, blend 1, blend 2, blend 3 functions, the doctor should set the output power manually on the screen. Note that the intelligent mode can only perform pure cut. If the surgical site requires better coagulation while cutting, it is recommended that the doctor chooses the blend mode for the procedure. The Monopolar electrocoagulation module is divided into 3 functions: soft coagulation, spot coagulation, and surface coagulation. The Monopolar electrocoagulation module is divided into 3 functions: soft coagulation, spot coagulation, and surface coagulation. Spot coagulation can achieve a small-scale, precise coagulation of the targeted tissue. To perform electrocoagulation, the tip of the electrode is slowly brought close to the tissue, generating an electric arc for coagulation. Surface coagulation can coagulate the tissue of larger area. When performing the surface coagulation function, the electrode head and slowly close to the tissue, generate an arc, and then drag the electrode, keeping contact with the tissue seemingly non-contact state for coagulation. Of course, the electrode can also be directly contacted with the tissue for coagulation, but the thermal damage and adhesion will be slightly increased. When the electrode surface has a more serious adhesion condition, it is necessary to replace the electrode with a new one or clean it before using it again.